Hello, my name is Rizime Guevara,
And I'm BJ Luis Gabor.
and today we're going to talk about cholera.
So for the definition, cholera is an acute diarrheal illness caused by Vibrio cholerae bacterial infection of the intestines. People can become ill if they consume cholera-contaminated food or water. The infection is frequently mild or without symptoms, but it can occasionally be severe and life-threatening. So for the pathophysiology, the chain of infection, cholera can be acquired through consuming infected food or drinking water. When there is an epidemic, the water or food is typically contaminated by an infected person's feces. In locations where sewage and drinking water are not properly treated, the disease can spread quickly. And then we have incubation. The incubation period of cholera is between 2 hours and 5 days. And then for the pathognomonic signs, the majority of people who are exposed to the cholera bacteria don't get sick and are unaware that they have been infected. However, individuals can still spread the disease to others through tainted water since they retain cholera bacteria in their stool for 7 to 14 days. Most cholera cases that result in the symptoms cause mild to moderate diarrhea, which is frequently difficult to distinguish from diarrhea brought on by other conditions. Others experience more severe cholera symptoms, typically within a few days after infection. So some of these symptoms is diarrhea. As much of a 1 liter of fluid per hour can be dangerously lost due to the fast onset of diarrhea associated with cholera. Another symptom is nausea and vomiting. Vomiting occurs especially in the early stages of cholera and can last for hours. And then we have dehydration. Mild to severe dehydration might appear hours after the first signs of cholera.
So for the diagnostic procedure, isolation and identification of Vibrio cholerae serogroup 01 or 0139 by culture of a stool specimen remains the gold standard for the laboratory diagnosis of cholera. Kerry-Blair media is ideal for transport, and the selective thiosulfate citrate bile salts, agar or TCBS, is ideal for isolation and identification. Commercially available rapid test kits are useful in epidemic settings but do not yield and isolate for antimicrobial susceptibility testing and subtyping and should not be used for routine diagnosis. So for the treatment, rehydration is the first priority in the treatment of cholera. The goal of the rehydration phase is to restore normal hydration status, which should take no more than 4 hours. Rehydration therapy includes adequate volumes of a solution of oral rehydration salts, intravenous fluids when necessary, and electrolytes. The antibiotic treatment requires fluid requirements and duration of illness and is indicated for severe cases of cholera, diminishes the duration and volume of the fluid loss, and hastens clearance of the organism from stool. And then the zinc treatment is shown to help improve cholera symptoms in children. Supplementation is 20 milligrams zinc per day in children 6 months or older and should be started immediately. Lastly, we have our nursing care. So we should monitor intake and output of the patient. We should note number and amount of stools, estimate insensible fluid losses like diaphoresis, and measure urine specific gravity and observe for oliguria. And then we should also weigh the patient daily, as daily weight is an indicator of overall fluid and nutritional status. We should maintain hydration in the patient as well and replace ongoing fluid losses until diarrhea stops. And lastly, administer medications as indicated. Give an oral antibiotic to the patient with severe dehydration as prescribed. And then here are the rest of our references. And that is all. Thank you so much.
Thank you.